name is Cindy Zellafro, and I'm the faculty member on the MOOC who's been discussing back and forth with you your thoughts and your ideas on the discussion boards. I'm thrilled to be here today with Dr. Melnick and Dr. Gallagher-Ford as we wrap up this last and final session of our MOOC with a little roundtable discussion. So, Lynn, as we get started in this final discussion, change is hard. Change is very hard, as we've discussed. But we've generated a lot of excitement and enthusiasm through the course. So we've got a lot of Lone Rangers who are out there excited to be EBP champions and change agents to get this started. Where would you recommend that they start?
Well, being the Lone Ranger is a difficult challenge, and I speak from personal experience. Back in my nursing administration career, I was the Lone Ranger of EBP many a time. And so some of it comes out of knowing your organization, doing some self-reflection on what do you know about EBP, how do you feel about it, what do you believe is possible, and knowing your organization. And so we do have great examples of people who have changed organizations single-handedly as, you know, a single nurse educator or a single professional development specialist or things like that. So some of it is, I believe, self-reflection, plus I think what Bern just talked about, knowing your organization and key stakeholders and really having a strategic plan. All those things we talked about, like where are you going to start? Where are you going to start embedding this? And one of the most important things is what's the message going to be? How do you have your elevator speech ready? So when people stop you in the hallway, that it won't take you 20 minutes to explain what your vision is, that you have your vision really nailed down and why it's important and how you can do it on the spot. So I think those are the things that I think are the most important for the Lone Rangers. And then building up, a team around you and beginning to really find out who those key people are that have the same vision and that can help to spread the word and spread the fever, I guess. So it can be done, though. We have great examples. My personal experience in big places and in small, complex places, simple places, academic places, community hospitals. I've seen it happen in any and all of those.
Fantastic. Thank you.
Mm-hmm.
So, Bern, you guys created the competencies, and the title in them reflects that they're competencies for registered nurses as well as advanced practice nurses. But do the competencies have applications outside of the field of nursing?
Absolutely. We developed these competencies originally for nurses. So the panel that came together, 7 experts in EBP who drafted them. We did the research through a Delphi survey to come to consensus. That research was also involving evidence-based practice mentors throughout the country. But since we've developed them, transdisciplinary teams, other professions have been using them. Because if you look at each of the competencies, they truly are transferable to any other health profession. So we have policy and procedure committees that are interdisciplinary and using those particular competencies to guide their work. Allied health professionals, pharmacists, occupational therapists, and so on, I think they're very applicable to medicine as well, sure, because they go through the EBP process. Competencies are really super important because they demonstrate a level of skill to others. So again, embedding those competencies in different ways in the organization will also contribute to a culture and an environment where EBP is not only supported, but it's expected.
And I think one of the things we found in the interdisciplinary work we've done is that it is totally possible for this to be a shared competency. EBP is not a competency that belongs to anybody specifically. I mean, a lot of places, they're really driving it through the nursing department, or they're driving it through, some other way. But this is a shared competency. This is like patient-centered care. This is like caring. I mean, everybody needs to come to the point of care with this competency. So using the competencies that we've developed is really just a tool to help you articulate and measure and describe what this should look like, rather than saying, gee, what should this look like? We're not sure, we think it's this, you think it's that. So they very much, can be used as a tool for this, what I like to call shared competency, that nobody owns EVP, everybody owns EVP. So they serve as a great tool in that way.
Very good, thank you. Last, we know that the message is more important or as important as the messenger. So again, as our EVP champs head off to bring this message to their organizations, what message would you encourage them, or what would you encourage them to include in their messages?
Well, I'll take that one. I think it's the most important thing that they can do, at whatever level they're at, whatever their role is, wherever they fit in the organization. I think the most important thing to do when you're trying to be the EVP champion, trendsetter in your organization, is to not spend a lot of time talking about what you need people to do, but to talk about why it's important. And there's a great TED Talk by Simon Sinek, who's an ethnographer, and he does this great talk about it's not what you do, it's why you do it. That's what gets people excited, as Byrne talks about. And that's what you talk about when she talks about the vision, the dream. That's the stuff you need to be talking about. A great example of that is, Martin Luther King, that Simon talks about, which is, always remember, he didn't give the I have a plan speech, he gave the I have a dream speech. And that's what people showed up for. And so I think that's a great message. Go forth into your organization, whatever size or depth or complexity it may be, and really go forth and give the I have a dream about EVP speech, not the I have a plan. You can fill in you can give them the plan later once they're engaged and on board, and they'll come along, because once they share your vision, they share your dream, they'll be able to help you. They will be engaged, and engagement is a big deal these days. And engaging in this dream to make EVP real and to bring forth those outcomes that come as a result of it is just, very inspiring, and I think it's the most important thing in terms of really getting it going and sustaining in your organization. That would be my advice.
Absolutely. Dream, discover, and deliver. EVP.
And we'd like to thank each and every one of you for joining us through the course of this MOOC. As Byrne said, we hope that your experience with the MOOC has not only extended your knowledge, but brought that twinkle to your eye and that fire to your belly as you all go forward to bring evidence-based practice to the world and make a difference in healthcare for all. Thank you.